Friday, August 3rd, coming up on an all-new View. It's Hair Loss Awareness Month, but we're showing you there's hope for the nearly 30 million women dealing with it with the latest, most effective ways to prevent baldness and even grow new hair. All that, hot topics and more, coming up on The View.
Women are suffering from hair loss, and they know that it's not just a problem that men deal with. So since it's Hair Loss Awareness Month, we are finding out the latest ways to fight it from dermatologist Dr. Doris Day. Welcome back. So I didn't realize that this was I mean, that's a huge number. Is it all ages of women, and how do they lose it differently than men?
So both men and women lose hair loss. Up to 30 million women suffer from hair loss. And just to give you a number, up to 50% of women by the age of 50 will have complained of hair thinning.
Yeah, but they're not bald the way men are.
They don't get bald the same way. That's a great point.
Is that a pattern?
Yeah.
Men and women do have different patterns. So the male pattern hair loss is that they start to lose in the temple region, then the crown, and then it all kind of meets up, and they typically go completely bald at times.
Okay.
For women, they tend to keep the frontal hairline, and you see a widening of the part, and then the crown kind of thins out over time. But you don't tend to go completely bald in the same way.
Are the causes the same for both men and women?
So genetics is the biggest cause for both men and women, so that is true, but it's a different underlying genetic hormonal pattern for women and for men. So sometimes for women it can be like polycystic hormonal disease, it can be pure genetics. There's also different types. We have some before and afters. This is stress shedding, and this is really not a true hair loss. It's when you go through a stress like childbirth or chemotherapy or a major life event. You can have shedding about 3 months later. There's also an autoimmune condition called alopecia areata, where you lose round patches of hair. This is an internal problem that affects the hair on any part of the body, and sometimes if you're unlucky you could lose all your hair from it, but most of the time with proper treatment we can help it grow back and keep it that way. Stress is a big component there. This is the hormonal female pattern where you could see diffuse thinning through the crown. It's not pure baldness, it's just a lot of thinning throughout the scalp.
Well, we have some solutions here. We actually have a patient, Loretta.
Yes.
Now, let's talk about this. This is a laser cap?
Yeah, so this is a lot of fun. I'm turning on this laser cap. So it's very discreet. You have this low-level laser.
Except your head is going, it's flashing. It stops traffic lights.
Exactly.
Well, that's not bad.
You wear this when? Throughout the day?
You wear it 20 minutes every day or every other day.
When?
Whenever you want, just 20 minutes a day.
Bald, when you're
no, that's a great question. Yeah. So the more hair you've lost and the longer you've lost it. So if you're completely bald, let's say as a man or with a woman, the longer the hair is gone, the harder it is to get it back. So it's really when you're noticing the thinning, and women know when the hair is thinning.
Your hair thins a little bit, so you go to your dermatologist, and most dermatologists have these hats and know about this?
No, it's becoming more and more popular, but there's a lot of hype. And what I love about this is it treats the whole scalp at once in 20 minutes.
Okay.
Every day, 20 minutes.
Every day, 20 minutes.
How expensive is it?
So this is pricey. This is up to $3,000 for this one. But I will tell you,
you own it.
You own it, and also it goes on more than one head, and you can change the hat. So a man might want to wear a
20 minutes a day for how long before your hair goes back?
Everything we do to regrow hair, you have to do indefinitely in order to maintain that hair growth. So we're not curing anything.
Week this is, or every day this is?
This is every day or every other day.
Every day for the rest of your life you wear this hat.
20 minutes.
But the way I look at it, it's 20 minutes of doing it. It treats the whole hair at once. And when you have a hat,
it looks funny with a ball gown, but that's okay.
No, I mean, if you're losing your hair, you want a solution, and if that happens to be it, let's talk over the counter.
When you look at me, I see something
All right, thank you, Roxy. Well, the Bauman Medical Group is here today with us. We have with us Dr. Alan Bauman, and we're going to talk about something a little bit different. This time of the year, a lot of folks are under a lot of stress. And then you add in maybe a divorce or a death for a woman, and sometimes it leads to hair loss.
That's right, Trina, and thanks for having me back.
Oh, it's really a pleasure always to have you.
What we know today is that there are social factors, like you mentioned, divorce, stress, smoking, drinking, that influence hair loss. And a recently published research paper was published to show that there's this strong connection. So we had a hunch before, but now we know.
Really?
So
you know,
the research is there that we that there's a strong connection between stress and hair loss.
Okay, so what does a woman do about it? Does she have options?
Oh gosh, yes, and for men and for women.
Okay.
There are options. The most important thing is to get the right diagnosis. So if you think that you've got hair loss in the family and you're seeing the signs of your changing hair volume or changes in your hairline or changes in coverage, you've got to find a doctor that specializes in the treatment of hair loss.
Well, this time of the year, if you were getting it, then does it mean that you're going to continue to have it, or maybe it's just the stress of the holidays or some kind of event in your life?
Well, we know that large sessions of stress or these bouts that can occur, or even general surgery and things like that, can exacerbate the hair loss problem. But if you have the genetic tendency for hair loss, then you have a much longer term problem.
Okay.
So sometimes a short term stress can resolve on its own, and we can monitor that.
Okay.
So some of the non-invasive ways that we look at the hair, we can say, hey, well, okay, you went through a stressful period. A divorce or death in the family. We can track that regrowth over time in the office.
Would you start them off slow with something not too much, not invasive or something like that first?
Well, yeah, absolutely. At Bauman Medical Group, we have treatments that range from minimally invasive, non-chemical, non-invasive treatments like nutrition, such as Viviscal or biotin, to low-level...
And those are supplements?
Those are supplements, right? Laser therapy, like in the office, or with a personal handheld laser like the Nutrieve or the LaserCap.
And so this is the Nutrieve right here, right?
Sure. This is a relatively new handheld personal laser that patients can use if they want to apply the laser therapy at home. And then, of course, you have the Mac Daddy, which is the LaserCap for completely hands-free use. And then we go into the FDA-approved treatments like minoxidil topicals, or for men, Propecia pills. The idea is to try to slow or stop the hair loss process and reduce the need for hair transplantation.
And so now these are minoxidil, so that would be like drops?
Correct. Minoxidil is the FDA-approved topical treatment that patients would use twice a day on their scalp to regrow thicker quality hair, to wake up hair follicles, let them grow thicker and stronger. Of course, everybody has heard of Rogaine over the counter.
Yes.
These are prescription versions.
So are they stronger?
They reduce side effects.
Okay.
And they have a better response at the scalp because of a synergy of ingredients. The way that they make these prescription items improves the effectiveness of the minoxidil.
Okay. Let's go to a couple of photos because you have some results.
Sure. This is a LaserCap patient of ours, seen here before she started the treatment and 6 months later in this photo, and 6 months...
That's pretty dramatic.
Yeah, she had an amazing response to the low-level laser therapy, and this is with the LaserCap.
And she wears it every day for how long?
Well, LaserCap treatments are 30 minutes every other day.
Oh, wow. Yeah. And what's the cost on that?
LaserCap is about $3,000.
Okay.
Now, this is another patient after a year's worth of treatment. But again, if they don't want to use the completely hands-free LaserCap, then they can go to a less expensive, more moderately priced personal laser therapy device like the Nutrieve, which is about $500.
Okay, but it's probably going to be more direct and better results if you do the cap, though, right?
Well, Trina, compliance is the key. You got to have the dosage and the delivery system for these kinds of treatments, but you have to do it. It's like joining the gym and forgetting to go, We always find an excuse not to go. But if you're trying to treat your hair loss, you've got to be consistent. You've got to be regular and regimented about it. And one of the things that improves compliance is prescription minoxidil, like the Formula 82M, or the powerful LaserCap, which is completely portable.
All right. Well, Dr. Bauman, thank you so much. It's a pleasure seeing you again. Well, the Bauman Medical Group is located at 6861 Southwest 18th Street, Suite 102 in Boca Raton. To make an appointment, you can give them a call at 561-394-0024 or log on to their website at baumanmedical.com. Sherry, over to you.